Good evening, everyone, and welcome to the Business of Aesthetic Expert Panel. Tonight, we're doing something special, a one-on-one, in-depth conversation about integrative medicine and aesthetics, merging hormone therapy and wellness beauty. My name is Don Adisha. At Business of Aesthetics, our mission is simple. Your success matters. So thank you very much for joining us, and please use the chat to ask questions and share your reactions as we go along. Now, before we do begin, I would like to share a quick update. Unfortunately, Dr. Tanya Lawson, who was supposed to join us here tonight, is unable to do so because she is unwell and sincere apologies. We wish her a speedy recovery and look forward to having her back with us very, very soon. Now, here's something every practice owner needs to start thinking about, right? The way patients find you online is changing fast. Traditional SEO and ads used to guarantee visibility, but with AI-driven search tools like ChatGPT, Google AI overviews, and even voice assistants giving direct answers, your website might never ever be seen. The old model of just ranking on Google is breaking. So the question becomes, how do you make sure your practice is still the one that patients trust and choose? The answer lies in becoming the authority AI recognizes. That means building expert-driven content, earning digital trust, and making sure every piece of your online presence reinforces your expertise. Because in this new world, success isn't being found, it's about being recommended by AI. Stick around until the end of this session because we've got a special tool for you that could really help your practice's online presence take it to the next level. And of course, that's made possible by Echo Marketing, tonight's event. So we are really passionate about this topic at Equa as well because it gets to the heart of what we do, helping great practices stand out. And now, I would like to introduce our expert here with us tonight. We are joined by Dr. Carolyn DeLucia. Dr. DeLucia is a board-certified OBGYN, a leading expert in women's intimate health, and a true pioneer in non-invasive aesthetic rejuvenation. With nearly 30 years of clinical experience, she has trained thousands of practitioners, authored two Amazon best-selling books, and was a featured contributor in Tony Robbins' acclaimed book, Life Force. She is the perfect guide for tonight's deep dive. Dr. DeLucia, thank you so much for being here.
Thank you so much, Don, for having me. And I'm very excited to share as much as we can fit in the time we have to inform women about never having to suffer in silence anymore.
Wonderful. Love that. Um, and for our audience members, the main points for tonight's discussion, as you will see, it's structured around the key pillars of modern integrative practice, from the synergy of wellness and aesthetics to personalizing treatment plans and expanding your offerings. And of course, building that long-term patient loyalty. Now, before we dive into the Q&A, we've only introduced the panelists, the topics, but let's get to know you, our audience members. If you don't mind, do me a favor and find the chat box below and type in where you're tuning in from. We would love to see where our audience is coming from and yeah, get to know you because, like I said, this is a two-way street. So the conversation goes between both of the panelists as well as you, the audience members. So as you find the chat box below and let us know where you're tuning in from. Oh, we got New York in the building.
Yay!
And Tanya Adams. So yeah. Okay. Fantastic. Thank you, Tanya. Hope we continue the energy throughout, and as we wait for everyone else's to drop in their locations, I'm just going to get ready with the questions. So, Dr. Delucia, let's dive in. You've been at the forefront of integrating hormone therapy with aesthetics. Let's start with the foundation. How do you see hormone balance influencing skin health, aging, and overall aesthetic outcomes?
Well, I think that the most important aspect about aging and the famous question, do we age because we lose our hormones, or do we lose our hormones because we age? Bottom line is, it doesn't really matter, the chicken or the egg. We age without hormones. That's it. And when I take an approach to my patients, it's really a approach for longevity. A
Mm,
baby born today has a life expectancy of 120. So when we think about that, and we are in our 50s, I'm in my early 60s, how can we maintain our wellness to last till we're 100, let alone our children's babies 120? That is unbelievable. So, with that in mind, our hormones have to be balanced first. And with that balance in place, our skin is naturally in a better place in order to accept the aesthetic procedures that we have to offer. Using even a good skincare product on our face will respond better with hormones involved. There's a big trend right now towards using a topical estrogen that's called estriol on the face, on the arms where women get creping. And the craze there is because of this exact fact. Our skin starts with the predisposition to needing the nourishment of our hormones. So, the beauty, though, I will say, is that if you are
mhm.
taking adequate systemic estrogen, you don't need to put it on your face because it's working from the inside out. Then, when we use lasers to rejuvenate skin, or the more modern use of microneedling, radio frequency, when we use that type of energy with a skin that is nourished with the natural hormones, it's going to respond better. We're maintaining our collagen and elastin. So one feeds the other. And if you have good looking skin, you'll have confidence and you'll just go out in the world feeling better about yourself.
Okay, let's break that down for our practice owners. How do you recommend, starting that conversation? What's a simple, effective way to bridge the topic from common aesthetic concern like wrinkles or skin laxity to the underlying topic of hormonal health?
Okay, well, we know that the majority of aesthetic patients are women. Not that the male group isn't growing, but women are still the majority. So I don't think it's out of place for a esthetician doing a skin cleaning to say, "Oh, hi, are you in menopause? Are you on hormones? What do you think about that? What kind of symptoms are you having?" Because, and another thing, you might be doing a treatment on a patient and she might have a full-blown hot flash, and oh my goodness, are you suffering with that now? How is that impacting your quality of life? And then you can ask about how they are approaching their wellness with menopause and perimenopause. Most women don't even know what's happening to them, and they are suffering unbelievably.
Mhm.
So when they show a sign, it's not, they're looking for help if you have an answer.
Okay, so really being aware, right? And
Hmm.
trying to always look beyond just what they're asking for because you're the expert, and then connecting that back to hormone balance.
Right.
Now, what are some of like the biggest misconceptions or mistakes you see practitioners make when they first start exploring hormone therapy as part of their aesthetic practice?
Well, I think that it's not an easy thing. And
Mm,
you do have to have a foundation of knowledge of the endocrinology. So I wouldn't suggest jumping into the hormonal world if you're not prepared to truly do it safely and correctly. So you may want to have a dedicated practitioner who is specifically going to do that as an adjunct to your practice. I don't think it's something, unless you're a gynecologist and an endocrinologist or primary care who's already been doing this for a long time, to delve into it all of a sudden. It may be wise to bring someone on to do just that.
okay, okay. So definitely one of the most common misconception is to not have that foundational knowledge, right?
That's right.
And to dive in deep without having that safety in mind.
Very much so.
So, Dr. DeLucia, you've pioneered several non-invasive treatments for women's sexual health, several.
Yes.
So, how has these therapies evolved over the years? And what emerging technologies are you most excited about today?
Well, I'm going to tell you that this is a ever-growing field. And what has evolved over the time that I've been here is astronomical. It blows my mind. The very first device that came to market was a CO2 laser. The CO2 laser is the gold standard of all aesthetic procedures. It was the first type of energy used to resurface acne affected skin. So we're going back 40 years. But in around 2010, the laser was altered to have a handpiece that could be used in the vagina. And I'm telling you, when the first representative walked into my office and said, I have a laser that rejuvenates the vagina, I kicked him out of the office. I said, get out, you pig. I said, you're not welcome here. And I said, no, we don't need any such thing. And he goes, but listen, please listen. It might help urinary incontinence. Well, that dropped me right there, because understanding lasers that I had been using for hair reduction and skin lightening, all of a sudden, if there's a laser that could be used to help the vaginal tissues to support the bladder and stop urinary incontinence, that was going to change the world. And it truly has. So, the ability to treat the full length of the vaginal vault with CO2 laser or erbium laser and have those tissues able to grow new collagen, elastin, and blood flow eliminates or minimizes the urinary incontinence that afflicts more than a third of women. More than a third of women in this country, on the world, have urinary incontinence. And with urinary incontinence, and this statistic breaks my heart, 45% of those women won't be intimate with their partner. And the reason being shame. Shame and fear of leakage during intimacy. So, if there's a simple way of treating urinary incontinence and not normalizing it, women don't take it, don't suffer in silence. There are solutions. So, using the CO2 laser for urinary incontinence caught my ear. And I jumped on board into this field of using aesthetic devices in the intimate wellness world. The confusion is that when you say aesthetic or cosmetic, people think that it's to make it look better. We're not worried about appearance of the vagina. We're worried about function. So these devices improve the natural function of women's genitalia. And therefore, the laser was the first to come to market. It's expensive, and lasers are invasive, and in a lot of places can only be used by physicians. What evolved next is Thermiva, or a device that used radio frequency to treat and heat the walls of the vagina in an attempt to mimic what a laser does. It's not quite as effective, but it does work. It takes longer, but that energy can heat the tissue at a depth of 1 centimeter, and it will affect new collagen, new elastin, and new blood flow to the area as well. It takes a little longer for full effect, but it has evolved. The very first device with radio frequency took 30 minutes to do a treatment. Now, I did the clinical trial on a device that only takes 8 minutes to treat the full vagina. That's a big difference. And sitting there treating the area for 8 minutes is very doable, no pain whatsoever, and is very safe and effective. So that was the next evolution. And then, lo and behold, I go to a meeting and there's this crazy looking chair that looks like it's from outer space. And you sit on it, and it's a 2.5 Tesla magnet. It releases energy in a cone fashion and makes 100% of the pelvic floor muscles contract. It makes you Kegel 11,200 times in 28 minutes. So after 6 of these treatments, urinary incontinence is cured in 75% of patients, and 60% of patients who were literally wearing diapers didn't need them anymore. So that's simply amazing. I call it the best seat in the house. And here's the kicker. It works for men too. So you go into the office, men or women, fully clothed, sit on the chair for 6 visits, and it improves urinary continence. And we did discover subsequently it improves sexual function, both in men and women. It improves erectile function as well as female sexual function. I did that study too with several physicians across the nation. And we saw a 62% improvement in all sexual areas: orgasmic function, lubrication, sensation, and libido, straight across the board, with a 62% improvement in each area. And that's really incredible, from just fully clothed, sitting on a seat comfortably. As a practitioner, the beauty of this is it doesn't take your time at all. So the chair can help your patient while you are seeing other patients in another room. And that's very valuable, because if we aren't making money when we sleep, or if we go on vacation, we're never going to retire. You have to have different streams of income when you talk about the business of aesthetics. Right there, you've got it. It is a business. We are in the business to help patients, but we also have to make a living. So making money on something that you doesn't take your time is a beautiful asset. And then we
Yeah.
evolved some more, even more. There's more to come. So then we found another energy, and that's low intensity extracorporeal shockwave. And that device is known as Duo, and it can have all the tissues have an increased blood flow at a depth of 13.5 centimeters completely painlessly in men and women. It's well documented in the literature to help with arousal in both men and women, and also help with urinary incontinence. And we're seeing studies coming out about prostate health. So these devices, I feel that one is one of those that I really find exciting because we're just at the tip of the iceberg of what this energy can do.
Okay. I mean, what I understood, yeah, definitely a lot to unpack over there, but definitely some things I understood, Doctor. Correct me if I'm wrong. It's initially the evolution that came about turning clinical treatments, right, such as the CO2 laser, into functional aesthetics, as you mentioned,
Correct.
right? And then
Yes.
from there, it turned into a matter of efficiency from one
Yes.
hour to 8 minutes. And then, of course, last but not least, we have now in the room comfort, a chair that
Yes.
you just sit on, and the doctor might be in the next room.
Mm.
And, your urinary incontinence can drastically improve, right? I mean, I can't even imagine doing 11,000 contractions into we're averaging around 2 to 3 contractions per minute if we were to do it just at home.
That's right. That's right. Good pickup. And I'll tell you what, if
Yeah.
we look at integrative wellness and we look at the trend towards weight loss, right? There's this huge movement into GLP-1 medications, which are the injectables that help you lose weight. What we
Mm-hmm.
have discovered is that these medications are basically a starvation diet. So what can happen is patients can lose 50% muscle mass and 50% fat. When you lose muscle mass, that is not healthy. And going forward, if you don't keep the weight off and you gain weight, it's not going to be muscle. It will be fat. And that's terrible. So you never want to exchange your muscle for fat. So in order to maintain muscle mass as best you can, not only working out, but the high fem technology has devices that build muscle in your arm, in your legs, in anywhere on the body. And the high fem technology called M Sculpt Neo also incorporates some radio frequency in the applicator. So it's high intensity focused electromagnetic energy. On the abdomen, for example, it makes you do 30 crunches, 30,000 crunches. Yes.
Oh, I'm
So
sweating just hearing that.
I know, but they have a special pattern that also flushes out. It kind of taps like this, and it's flushing out the lactic acid, so there's no discomfort following these treatments.
Really excited about that for sure. For
It's
sure.
a little cheating, but it works.
Yeah, I mean, considering the evolution that it took to get there, that makes sense. It really
Exactly.
does. Wow. And Dr. DeLucia, just for practice owners on a limited budget, it
Mm-hmm.
might be overwhelming thinking about investing in such heavy machinery and equipment, right?
Yes.
How would
Yes.
you advise them to differentiate between a long-term, smart investment and just a passing trend when evaluating these new
Mm.
devices?
Well, that is a great question. And I wish I knew the answer a few years ago, 20 years. Don't buy more than one device at a time and make your ROI, which is your return investment. You want to be able to pay off that device. And what you have to do is make the math in your head simple. Figure out what your monthly expense will be to pay off that device, how many patients you will have to treat to accomplish that coverage of that lease or your payment. And then once you know that, then you can work towards that and think, will I be able to have that many patients each month to cover my expense? And if you can't, don't buy it and wait. So that's the first thing. Are there going to be trends? Unfortunately, in aesthetics, there are going to be some that come and go, but that's not always a bad thing. I will say CO2 is a very safe energy. It's been around for 40 years, it's not going anywhere. The only change with it is that the way it's delivered has been improved. So it's a matter of understanding using the device that you do purchase to its fullest, make some profit, and then you can move on and upgrade. But don't stay stagnant for fear of not making your money back, because you do want to evolve with the changes that become available, because they will go down the road to the person who has the hottest and the greatest if it's significantly better.
Right. And for those who made the unfortunate choice of buying that piece of equipment that stays, in that dark corner for years on end, what would you say to those practice owners?
Ugh. I've done it. I wish could say I never made that mistake. But I think that one of the things I highly recommend is try to speak to as many practitioners who own that energy before you buy it. Do not only speak to the salesman. And yes, they will give you physicians who are biased towards that device, but ask enough questions to get past that bias that the physician has a loyalty to a particular device maker. So they're going to be involved perhaps in a clinical trial. I've been involved. Am I more Do I like my little babies, the ones that I helped bring to market, better than others? Of course I do. It's a natural way. But I will be honest about the comparative products on the market and what sets one above or how they differ. So do ask enough questions and get as much information from other practitioners as you can.
Okay, so definitely for our practitioners listening, practice owners, to really differentiate between a smart long-term investment and just a passing trend, it really comes down to looking at, well, first of all, buying one device at a time.
Yeah.
So that, makes it really you will have to do a lot of due diligence on your own to ensure that is the device that you want. Consult
Yeah.
with different practitioners who have experience on the device
Yes.
and calculate how many patients it would take for you to see a monthly and make that return. If you can, go ahead with the device. If not, maybe hold back a little bit more. But definitely don't let that fear of buying that device or not being sure about a device hold you back. But always try to ensure that you have done the necessary research and due diligence, right?
Correct.
Right. And Dr. DeLucia, how do you communicate the value and ROI of these advanced treatments to patients who might be hesitant about the cost? Now we're talking about the patient side.
Okay. So I try to, I never estimate or try to figure out how much a patient can afford. Because, in my opinion, what really matters is how serious the condition is for that patient. And always give them a best possible plan, what that plan might cost to achieve a solution to their problem, and then speak with them if they say, oh, wow, no, I could never get that. That'll take me 2 years in order to get that much money. Then modify the plan to something that does suit the wallet that they have. But the first thing is, I will give them the honest opinion of the best tools I have that would bring them to a solution. And for a perfect example here is a woman suffering with lichen sclerosis. This is a skin change that affects the whole vulva area, and it's a devastating condition. And it's very, very difficult to treat. The standard of care is just to slop on high dose steroid creams and ointments. The problem there is that those ointments, in and of themselves, start to change the tissue. And then, as the physician, you're not sure what you're treating, the steroid reaction or the disease anymore. So, patients can suffer horribly from not only the disease, but the treatment itself. So, using regenerative procedures, which we haven't even delved into here, such as PRP or exosomes, this is a new realm of the world that is so healing. It has such healing powers that it's the future of medicine, all medicine. Exosomes are being used to treat brain injuries by inhalation. They're just squirting them in the nose and they're going into the brain and healing the brain. So, using exosomes to treat lichen sclerosis is miraculous, the change that can occur in the tissue. And being able to use these procedures is sometimes costly and requires several visits. But I sell packages, reduce if they purchase packages, and that type of thing, and work with them to get them the best solution possible.
Right. So definitely when you're communicating value and ROI to patients, first of all, consider the ideal plan that'll get them to that solution.
That's right.
Um, yeah, and then talk with the patient, have a check-in, and then listen to what they can really do and modify
Yes,
that plan to match their wallet.
that's
Um,
right.
definitely. And Dr. Delucia, that's really a good point about communicating value. And it is the perfect segue for me to also mention our sponsor for this evening, Echo Marketing, because you can have the best technology in the world, but if you can't attract the right patients who value it, the investment is lost. Um, so, with that being said, I would like to share my screen. So, now if you're wondering, okay, this all sounds great, but where do I even start, right? So that's exactly why we're offering something special today. We're giving every attendee a complimentary marketing strategy meeting valued at $900, where our team, together with the marketing analyst of Equa Marketing, will personally help you build a roadmap for your practice to thrive in the age of AI. It's a personalized session where Aqua will be showing you how AI ready AI is already reshaping patient discovery in your specialty, right? And like what your practice's current online authority score looks like. This is key information that you might have underestimated in the past. And then, of course, top three trust signals AI is using to recommend and not just rank practices like yours. So, a very valuable session, and the link is in the chat, or you can scan the QR code to book it. It's completely complimentary and also, of course, non-obligatory. So it's just a way of eco marketing, and the business of aesthetics is giving back to the community. um, these sessions do fill up a bit quickly after every webinar of ours, so the insights you can get truly redefine how you attract your next wave of high intent patients. So while we continue, go ahead and secure your spot. It'll take 90 seconds and you'll be glad you did. So thank you. Dr. Delucia, let's get back to the questions.
Okay.
Okay. So when treating women in different life stages, like perimenopause, how do you personalize hormonal and aesthetic care to support both wellness and confidence?
Okay. Well, I get to cheat a little bit because I'm a gynecologist. So the majority of my patients are coming in with complaints about their hormonal status. They don't know that's what they're complaining about. They just don't feel well. Okay. So women between the ages typically, although I saw a 33-year-old with hormonal craziness today. But between the ages of 35 and 65 are experiencing changes that are really affecting the quality of their life. This could be a weight gain. The number one complaint is I can't control the weight gain and it's coming all in the middle. Every woman says the same thing. And what's happening is that we begin to go through perimenopause, which is the ovaries begin to fail. It's a crisis. The body views it basically as a crisis. And the one of the first signs of perimenopause is change in sleep patterns. So all of a sudden, women can't sleep through the night, or they're waking up drenched, absolutely sweating, and have to change their clothes. Very disruptive to the quality of their sleep. Therefore, their next day is terrible because they're exhausted. So once this happens, our body thinks it's being stressed and cortisol levels go up. Cortisol makes us insulin resistant. When that happens, we begin to pack away the pounds. Everything we eat gets stored for possible chances of needing to escape from the tiger on our shoulder. And it's just perimenopause. So, what ends up happening is the body thinks it's stressed, cortisol level goes up, insulin resistance increases, and we gain weight in the mid portion of our body. And then we feel terrible. No sleep. Now we feel fat. Now we are not attractive anymore in our own eyes. And the world begins to spiral. With that feeling, I listen and I say, I understand. I have been there. And what we should do is take a look, take a deep dive into your hormonal status, I look at cortisol, I look at thyroid, I look at ovarian function. And with all of these levels in front of me, I can then formulate a plan for that individual woman that fits her symptoms that she needs resolved first. And then once we get that under control, then we can approach her weight gain, and we can approach building muscle, like I mentioned, using appropriate devices, and help them begin to get their confidence back. And with that, they may have some loose skin from weight loss, either on their belly, or they may begin to have aging changes in their face. And we address, I think, look at this, I lost this weight in my face, Ozempic face, they call it. So you build that back up for them, and they feel beautiful again, as they always were. But when all these changes are occurring, you feel like you've lost yourself. So none of that has to be permanent. We can work with it. If you find the right practitioner, there are so many answers, which is why I love to be on these platforms to try to explain that there are so many ways to address these issues.
Right, Dr. DeLucia. So mainly what you're saying is to first of all listen to the patient, right?
Right.
And absolutely try to understand where they're coming from,
Yes.
and then identify accordingly, develop that plan, and prioritize according to the
Right.
patient's most biggest concerns, I'd say, right?
Yes.
Then once those are addressed, then figure out a way to help them bring back that confidence.
Correct. You
Right.
got
And okay, superb, superb.
it.
I hope the our practice owners are also getting it, because it's really a step-by-step guide that Dr. Delucia, who has years of experience giving this wonderful care to her patients, is
Oh, thank you.
sharing that with us. So really appreciate that, Dr. Delucia.
Thank
So
you.
another question that may arise is, since this is a pretty holistic approach, right?
Yes.
Perhaps, I'm saying perhaps, but I'm pretty sure it requires the entire teams to be on board. So, how are you training your staff from the front
Mm.
desk to the nurses to understand and communicate these nuanced, personalized plans effectively?
Yeah, it takes time. And finding the right staff, that's number one. Somebody who's truly interested in being a part of this team. That's critical. So if they don't participate in understanding and being a fan of what you're doing, fire them, get somebody else. Because it's true, because they will be toxic. If a patient says, "Oh, the doctor suggested that I get PRP in my face. What do you think about that?" "Oh, I'd never do that. I don't do that." Out the right? If my front desk person wasn't a cheerleader for everything I do, she's out, right? Because
Right.
your patient will be discouraged. So staff has to be on board and be member of your team and willing to assist. So being able to schedule, "Oh, I know exactly what we're going to have to do. I'm going to help you schedule all your appointments. You're going to feel so much better. You should have seen the 5 last patients that went through this protocol, and they're great." So big difference. My nurse supports everything I do. So, okay, Dr. Delucia just said we're going to do this with your hormones, and you're going to take this at this time. She goes over the entire plan again, has it in writing, forms that she's made up for them, and lab slips with the follow-up laboratory values that they have to go for, when to go, when to use the medication in correlation to when the blood is drawn, because all of these little nuances are important, and we work all together. Then we get results in. That's a whole nother ball game. Getting results. It's a lot because you have to relay this to the patient. So first we get lab work in, the nurse goes over it, Dr. DeLucia, here's so-and-so's lab work, and then I write a letter to the patient, send it to the patient, keep it in our record, then the patient returns and we have a face-to-face consult about the results, because formulating the plan is very difficult to do over a telephone. Someone's driving, they're not fully there or present. And I'm number one. I call patients back from the phone, from the car, but I'm not making their final decision in that moment. I may answer a question, but not, that's my bird. I'm sorry. But if you heard it say, but that is what we do. So we all work together as a team to take care of the patient the best we can.
Right. And if that team member is not interested in that uh, framework, right? In that framework and championing the really the practice and being a cheerleader, as you mentioned, that
Yep.
staff member might be in the wrong place, and you can help them find the better place by helping them move on, perhaps, maybe.
Absolutely well put. I said fire them, but you're very gentle and you're right. They're not happy there either. And that's a very important point. They're not in the right place, like you said. And when they find the right place for them, they'll be a much happier person each and every day going to work.
Right.
Well
And
put.
isn't that what we all want, to be a happy person at the end of the
That's
day?
right. That's
So
right.
that's wonderful. Now, Dr. DeLucia, as awareness of women's health and longevity grows, now we are
Yes.
looking at yeah, staying up until 120, as you mentioned early on.
Yes.
Whew. How do you envision the next evolution of integrative medicine and aesthetics for female patients?
I did touch a teeny weeny bit about on regeneration, and regenerative medicine is what I am seeing. It's going to take all of these aspects together. It's not just one tiny thing. It's going to take optimizing hormone balance, optimizing cardiovascular health. The number one killer of people in this world is heart attack, stroke, cardiovascular effects. So that must be addressed and maintained to the best of our ability. Once longevity is optimized and we can do everything we can in that realm, then it is a natural segue to want to feel and look better. So, with that, it's a very natural progression to want to get into the aesthetic world. What can I do to look better with my hair, my face, my skin, my waistline? What can be done to improve my confidence there? So it really works hand in hand. It's not necessary to ever separate them. And it's wonderful to have a practice that spans longevity all into aesthetics. And regenerative medicine is the future. It's where we're going to go to help heal osteoarthritis, possible brain injuries, sexual health. I have improved sexual function in men and women using exosomes from their own blood. And it's just absolutely incredible what the possibilities are. They're endless.
Right. Dr. Delusha, just early on in the discussion, you mentioned that the CO2 energy, although it had come out 20 to 30 years prior to it, it was only in 2010 that an evolution had occurred to specifically match the female intimate area, right? The,
Yes.
yes, the specialization occurred. Hence why I was also curious with regards to this question itself. What is what is in store for our female patients particularly? Are we catching up on some technology that might have been there for
Well,
some time, and now we're
yeah.
specializing into the female category.
Yes. So
What's there in the future?
So I did a trial on micro needling, radio
Okay.
frequency, and improving the appearance of the external genitalia. I bring that up because some women have conditions where the labia minora are extremely large and bothersome to a point where it does affect function. Again, it's not just about appearance. And some of these patients in the past have had to go through very extensive surgeries to minimize the size and the annoyance of the anatomy. But radio frequency, microneedling, and use conjunction with exosomes and PRP, we can improve those areas without surgery. So this is evolving rapidly by combining the different technologies to change the tissue to be more functional.
Right. So longevity definitely would be part of the next evolution, right? We're looking at once
Oh, yeah.
longevity is optimized, as you mentioned, um, then perhaps we will be looking into the more beauty aspect of it, how we are looking and how
Hmm.
we want to feel better. And then, of course, what's really in store, as I'm understanding, is doubling down on functional aesthetics. At least that's the real interesting part of everything, right? How functional aesthetics is really evolving. And for our practice owners listening in and who want to be part of that evolution, what would you think is the tangible first step they can take in the next 90 days to begin future proofing their practice?
Education. All begins with education, training. So, at the very beginning, you mentioned that I've trained thousands and thousands of practitioners. Indeed, I have. There are courses all around the world by students I've taught who have started teaching themselves. And they have evolved and done things I would never have been dreaming of doing because science evolves and there's always someone who's going to think of something you didn't. And I think that's wonderful. So I still go to courses, and everybody should go to courses where they can learn and see. You never jump into something just because you heard it on a podcast or you heard it on a webinar. Warning, warning, do not do that. Always, always learn, go to courses, conferences. There's a wonderful conference that I speak at in the United States in the March, February area. Usually every year, it's the ISCG conference, ISCG, and it's all about the cosmetic gynecology, and wonderful speakers from around the world congregate and talk about where this field is going. So I encourage everyone to come to conferences and learn, take courses from physicians. I welcome doctors to my office for 2 day, 3 day courses, depending on how extensive they want to go. And it's the most rewarding aspect of my practice. It's the hardest thing I do. It's very difficult to teach other physicians, but it is a lot of fun and wonderful way to get hands-on experience.
That's a pretty interesting point you made there. Being the hardest thing that you do
Yeah.
is actually teaching other physicians.
Yes.
But definitely for our practice owners, the real tangible first step, definitely get your education. And of course, this might be the start, but please, as Dr. Delucia mentioned, of course, a disclaimer, this
Yes.
is not the end. Um, so definitely
Correct.
get into your courses from physicians, licensed physicians, and
Yes.
yeah. Now, for our patients, just wrapping up over here, in this future model, right?
Yes.
I'm curious to know, how does the patient's relationship with the practice change? Does it change? Does it become more of a long-term partnership than a series of transactional visits?
Correct. I believe that they become family, and it's a way of really bonding with the whole team. And when a patient is involved in their own care, we give them participation at home. They need to do certain exercises, perhaps, or certain treatments at home to perpetuate and continue to see benefit from future treatments. We all work together to have a successful result. So, home care is also important, and getting a patient involved in their own care and an active participant in their healing.
Okay. Home care, and then, of course, the patient's relationship
Hmm.
becoming almost like family. That's very intimate, Dr. Delucia. And
Yes, I love
yeah.
my patients.
Well, with that being said, Dr. Delucia, I think we have approached end of this session. I would really like for you to tell us, what is one key takeaway, if our audience members have listened to this session, can take away from it with them?
Okay. Please do not suffer in silence. If you feel that you're not yourself, if you feel that you are unwell, don't settle for, oh, well, it's just menopause or perimenopause, or you just got to live with it. We don't have answers. Keep searching. And please reach out to me, to the business of aesthetics. They will help guide you to a physician who can give you the appropriate care you deserve.
Absolutely. And what about for our practice owners? I mean, I know some of them might be going through the same, but
Well, to the practice earners and the practice owners, please just be willing to listen to your patient and keep an open mind to technologies that approach, and never stop learning. You're always a student.
wow, okay. With that being said, so yes, with that being said, we are at the end game. Thank you very much for your wonderful insight and your very open answers, Dr. Carolyn DeLucia.
Thank you. Thank you for
Absolutely,
having me.
absolutely. Absolutely. And for our audience members, thank you for investing an hour into your practice. Um, and of course, spending it with us. We really appreciate it. And of course, if you are still interested in making an actionable step towards growing your practice, the link is in the chat one last time to book your marketing strategy meeting with our sponsor, Equa Marketing. With that being said, we, the whole team at Business of Aesthetics, wish you, as well as on behalf of Dr. Delucia as well, a wonderful week ahead, a successful week ahead, and until next event, take care.